Today I am going to tell you about the basic concepts in prevention. After I complete teaching you this, you will be in a position to know about prevention that is required for mental health issues, the various types of prevention and its integration with other types of care. You will also be able to identify the strategies of prevention and other programs and evaluate what types of prevention is needed when, and also know about the effectiveness of prevention strategies. Now let us begin with what prevention is all about. Prevention is a common sense concept that derives from Latin words meaning to anticipate or before something to come. The concept of prevention is found in all aspects of public endeavor. Parents try to prevent children from hurting themselves. Police try to prevent crimes. The legal system is designed to prevent violation of certain rights. Road signs are created and posted to prevent people from getting lost. While the idea of prevention can be found throughout the written history of humankind, the idea that prevention concepts could be systematically applied to mental disorders has a very recent history. Let me give you a brief history of prevention. In 1959, George Albee looked at a number of people in the United States who could benefit from mental health counseling in a given year. Then, he looked at the number of mental health clinicians the country could produce. His analysis showed that there could never be a sufficient number of clinicians trained to provide all the needed mental health services for the population. Consider the implications of this extraordinary finding. Therapeutic resources were scarce and would realistically remain scarce. If we continue to rely on one-to-one professional to patient method for providing psychotherapy, the US society would never be able to train enough professionals to provide therapy to everyone who needs it. Prevention in mental health has a history of over 100 years. Since the early days of the mental hygiene movement at the beginning of the 20th century, many ideas have been generated on possible strategies to prevent behavioral problems and mental disorders in children and in adults. These have been partly translated into experimental activities in primary health care and schools and in public health practices. However, the systematic development of science-based prevention programs and control studies to test their effectiveness did not emerge until around 1980. Over the past 30 years, the multidisciplinary field of prevention science in mental health has developed at a very rapid pace, facilitated by increasing knowledge on malleable risk and protective factors. This has resulted in a fast-growing number of scientific publications and effective programs, as illustrated in a summary report that I will present to you. Prevention research centers, universities, and other institutions, along with program managers and practitioners, have generated evidence showing that preventive interventions and mental health promotion can influence risk and protective factors and reduce the incidence and prevalence of some mental disorders. Let me move on to the concepts of prevention. About 450 million people suffer from mental and behavioral disorders, and it is very necessary to provide them all with essential treatment and prevention strategies so that before they lead to more serious and deadly condition, they can be prevented. Prevention is defined as those interventions that are targeted at the general public or to a whole population group that has not been identified on the basis of increased risk. In today's lifestyle, where everyone is very busy with their work, stress is one major factor that contributes maximally to individuals having trouble. Kaplan in 1964 made a distinction between the following three types of pre-primary prevention. This is intervention given to entire population when they are not in a condition of known need or distress. The goal is to lower the rate of new cases from a public health perspective to reduce the incidence of disorders. Thus, further three kinds of prevention are primary prevention, secondary prevention and tertiary prevention. Let me tell you about primary prevention to begin with. Primary prevention aims at reducing the possible harmful effects of disease before it becomes to cause problem and leads to a greater difficulty of trouble. Primary prevention is necessary because it helps in reducing the root cause of the diseases and health issues. The example of primary prevention is such things as vaccinations, fluoridating the water and providing decision making, problem solving and skill building programs to children in preschool. Similarly, primary prevention can be thought of as being applied to all persons or in a given setting regardless of potential need. For example, all 5th graders in preparation for transition to middle school or all first year college students. Sanitation can be maintained by the use of clean water, by hand washing. Similarly, safety of an individual can be assured by the use of seat belts and helmets. These are the examples of primary prevention. Thus, now you will be able to understand that primary prevention aims at providing long-term solutions to problems. Let's go on to the next topic, which is secondary prevention. Secondary prevention aims at providing intervention to the population who shows early signs of disorder or difficulty. Secondary prevention presupposes some method of determining which individuals are at risk. Now, identifying such individuals creates a potential for stigmatization, both because they do not currently have a disorder and because they might never develop one. Now, improving methods of risk identification represents an important area of work in community psychology. Thus, secondary prevention on one hand provides a training to individuals and on the other hand teaches them strategies to deal with hazardous situations. Also, there are various awareness activities that can help individuals to deal with mental health disorders. Skill development programs are aimed at improving the knowledge of individual adjustment strategies to deal with stress or relieving the symptoms of stress, for example, relaxation, physical exercise and so on. Now, secondary prevention aims at little aspects that can be corrected in life and the individual can lead a healthy life where he thinks the positive follows a healthy lifestyle and regular exercises can help him stay fit and healthy, so he indulges in them. Moving on to tertiary prevention. Tertiary intervention aims at providing intervention to the population who have an intention of limiting the disability caused by the disorder, reducing its intensity and duration, and thereby preventing further future reoccurrence or additional complication. This type of effort, when applied to individuals, is referred to as rehabilitation. When these efforts are directed towards population, they are labeled tertiary prevention. Now, tertiary prevention aims at treating people as well as rehabilitating them to face the upcoming challenges. For example, a child psychiatrist by training, Kaplan was trying to introduce preventive way of thinking to the treatment-oriented medical, psychiatric, mental health and social service fields. By emphasizing the similarities of prevention and treatment, he was able to link these concerns. Ultimately, he was successful in the idea of prevention that took hold, becoming a central tenet of such fields as community psychology and school psychology, and increasingly clinical and health psychology. However, Kaplan's framework appealed to those seeking resources for treatment. Some early prevention grants were given to programs designed for such things as tertiary prevention of schizophrenia, a worthy goal, but not exactly what Kaplan had in mind. Prevention, even tertiary, is on a community level. As many have noted earlier, prevention is a difficult concept to grasp. Moving on to interventions in India for community mental health. The basic model of community mental health model was defined by Gerald Kaplan in 1967. According to him, predominant characteristics of community psychiatry are: number one, responsibility of a population for mental health care delivery; number two, providing continuity care; number three, emphasis on prevention as well as treatment; number four, avoidance of unnecessary hospitalization. In 1975, the WHO strongly recommended the delivery of mental health services through primary health care centers as policy for developing countries. And finally, in India, attempts to develop models of primary health mental service settings are made nearly simultaneously at PGI Chandigarh in 1975 and NIMHANS Bangalore in 1976. Now, I'll talk about community mental health services. Community mental health services, CMHS, as known in the community, mental health treatment in the United Kingdom support or treat people with mental disorders in a domiciliary settings instead of a psychiatric hospital asylum. The array of community mental health services vary depending on the country in which the services are provided. It refers to a system of care in which patient community is not specific facility such as the hospital, is the primary provider of care for people with mental illness. Community services include housing, supported housing with full or partial supervision, something like halfway houses, psychiatric wards of general hospitals including partial hospitalization, day centers or clubhouses, community mental health centers and self-help groups for mental health. Now, at the next level of primary healthcare services which are necessary could be the formal services such as visits to the psychiatrist or long stay in hospitals, or could be self-care like proper diet, nutrition, etc. Also, it is observed that if the need is high for mental health, then cost will also be high. That is, more the problem or the disorder, it increases the cost of the treatment. So these go hand in hand and there is a positive correlation. Thus, community mental health care in India is much needed concept where many people suffer from such issues as the non-availability of care. Let me talk about integration of mental health care into primary health care. Like I said, the burden of mental disorders is great in any country across the globe. Mental disorders are prevalent in all kinds of societies. They create a substantial personal burden for affected individual and their families, and they produce a significant economic and social hardship that affect the society as a whole. Mental and physical health problems are interwoven. Many people suffer from both physical and mental health problems. Integrated primary care services help ensure that people are treated in a holistic manner, meeting the mental health needs of people with physical disorders as well as psychological health needs. The treatment gap is enormous in all countries. there is one significant gap between the prevalence of mental disorders on one hand and the number of people receiving treatment and care on the other hand. Primary care for mental health closes this gap. Primary care for mental health is both affordable and cost effective. Primary care services for mental health are less expensive than the psychiatric hospitals for patients, communities, and government alike. In addition, patients and families avoid indirect costs associated with seeking specialist care in distant locations. Let's go on to promotion of mental health. The promotion of mental health is situated within the larger field of health promotion and sits alongside the prevention of mental disorders and the treatment and rehabilitation of people with mental illnesses and disabilities. Now, like health promotion, mental health promotion involves actions that allow people to adopt and maintain healthy lifestyles and create living conditions and environments that support health. Many within and outside the fields of mental health and health promotion recognize a need to assemble, review, and generate evidence about the tangible benefits of mental health promotion. This includes evidence on the relationship between social and cultural factors and the mental health of individuals and communities. Although there is a significant differentiation between prevention and promotion, both in theory and in practice, these fields are narrowly related and partly overlapping. Many prevention programs use a positive orientation and target the strengthening of personal skills and supportive environments. At the other hand, health promotion activities to reduce discrimination and violence and to empower local communities and to enhance, for example, mental health promoting school or work environments can contribute significantly to prevention of problems such as substance abuse, depression, anxiety problems and burnout. Now let me summarize what I have taught you. Prevention is a common concept that is derived from Latin words meaning to anticipate or before something to come. The concept of prevention is found in all aspects of public endeavor. Prevention in mental health has a history of over 100 years. Since the early days of mental hygiene movement at the beginning of the 20th century, many ideas have been generated on possible strategies to prevent behavioral problems and mental disorders in children and adults. Prevention is defined as those interventions that are targeted at the general public or to a whole population group that has not been identified on the basis of increased risk. There are three kinds of prevention: primary, secondary and tertiary. Primary prevention aims at reducing the possible harmful effects of diseases before it becomes to cause problem and leads to a greater difficulty of trouble. Secondary prevention, on the other hand, aims at providing intervention to the population who shows early sign of disorder or difficulty. Secondary prevention presupposes some methods of determining which individuals are at risk. And finally, the tertiary prevention. Tertiary intervention aims at providing intervention to the population who have an intention of limiting the disability caused by the disorder, reducing its intensity and duration, and thereby preventing future reoccurrence or additional complication. Now, this type of effort, when applied to individuals, is referred to as rehabilitation. When these efforts are directed towards the population, they are labeled tertiary prevention. Now, tertiary prevention aims to treat persons as well as communities. There is no sure way to prevent mental illness. However, if you do have mental illness, taking steps to control stress, to increase your resilience, and to boost low self-esteem may help to keep your symptoms under control. Some of the steps I would mention: number 1, pay attention to warning signs. Work with your doctor or therapist to learn what might trigger your symptoms. Make a plan so that you know what to do if the symptoms return. Contact your doctor or therapist if you notice any changes in symptoms or how you feel. Consider involving your family members or friends in watching for warning signs. Get routine medical care. Don't neglect checkups or skip visits to your family doctor, especially if you're not feeling well. You may have a new health problem that needs to be treated, or you may be experiencing side effects of medication. Ask for help when you need it. Mental health conditions can be harder to treat if you wait until symptoms get really bad. Now, long-term maintenance treatment also may help prevent a relapse of symptoms. Take good care of yourself. Sufficient sleep, healthy eating, and regular physical activity are very important. Try to maintain a regular schedule. Talk to your doctor if you have trouble sleeping or if you have any questions about diet or exercise. You must have understood by now that the best kind of prevention is the primary prevention. This kind of prevention is that prevention in which you take steps to reduce the possible harmful effects of any kind of disease before it actually occurs. But unfortunately, in India, our society wakes up when the problem has occurred. The disease is in full bloom, it is in full form. Like recently, nowadays, there's an outbreak of dengue. After people are getting afflicted by this viral disease, and there is an immense loss of life, and of course, this loss of life is also causing a lot of toll on the public health services. It is then that the authorities wake up and people wake up. So the kind of prevention that we look for, which is the primary prevention, does not happen. Despite the fact that each one of us recognizes that primary prevention is the best type of prevention. Now, what happens is that after the outbreak of a problem, despite the loss of life and the kind of taxing on the public health services, it is always that the authorities wake up when the problem has taken an immense amount, in the sense that it is out of proportion. We cannot control it. So we have to take measures so that we kind of do prevention which is primary. And if not possible, then secondary has to be undertaken. Like I told you, that secondary prevention aims at providing intervention to population who are showing signs of the problem, but the problem has not become too much as yet. But here we have to identify the individuals who are at risk. Like for example, I was talking about the dengue case. Here also we have to identify the areas and people who are at risk. We have to control the mosquito breeding, which would eventually control the problem. And then lastly, in case the primary and the secondary prevention has not taken place, we have to go on to the tertiary prevention. Now in tertiary prevention, like I told you, it is the intervention which is given to a population with the intention of limiting the disability that has been caused. So now the kind of public health services that are available have to be increased. The professionals have to increase. So the same way that the physical disabilities are being taken care of, the mental disabilities and the mental disorders have also to be taken care of at the same level, at a war footing. Mental disorders can be as debilitating and as dysfunctional as any kind of physical disorders, and prevention is the key to all kind of problems.